Hello, my name is Grace Quirk, and this research is a literature review on ICU nurse perceptions of and barriers to palliative care use in the intensive care unit. I chose to do this research because I'm incredibly interested in working in the ICU, and when I met with Dr. McKay, she suggested looking into how palliative care is utilized by nurses specifically in the ICU setting. Palliative care is an interdisciplinary approach to providing patient care focused on maintaining or improving quality of life for patients with acute or chronic illnesses. This is especially prevalent in the ICU. Key search terms were inputted into 3 databases, and I went through and narrowed down the articles by removing repetitions and excluding articles by analyzing abstracts, then full articles, in order to find the ones that are relevant to this topic. Through what we discovered, there are 4 major barriers to effective palliative care in the ICU. They are lack of knowledge, ineffective interdisciplinary communication, perception/attitude towards palliative care, and moral distress. 8 studies specifically focused on the lack of knowledge, and the other 10 studies include information on the other barriers regarding palliative care and how it affects the care provided. Nurses discussed how not receiving adequate training or undergraduate education on palliative care in the clinical setting leads them to be more uncomfortable in providing that care and starting the process of palliative care for the patient. On the other hand, some may be aware of palliative care and be in favor of using it, but not know how best to begin implementing it for their patients and discussing this with the healthcare team. Having to complete these actions that they don't fully understand can cause moral distress and turmoil in these nurses. ICU nurses recognize the significant benefits of integrating palliative care principles into the management of critically ill patients. And this can be built on by providing education to all ICU nurses about palliative care, integrating palliative care concepts into undergraduate nursing curriculum, improving interdisciplinary communication related to the palliative care in the ICU, and providing support services to nurses and team members who report moral distress.